Okay, we're going to start the lower limb, starting with the bones. Bones are what you see there, and the major regions of the lower limb include, first, the hip. The hip bone is also known as the hip bone or coxal bone, also known as AKA coxal bone. You see the term os coxa, it's the hip bone. You can call it either. And the hip, excuse me, to remember this. The hip is connected to the thigh. Thigh bone is the femur, and it's the longest, strongest bone of the body. The thigh. One femur bone in your thigh. It's the region between hip joint, knee joint in anatomy. When you get down to the leg, the region of the leg in anatomy we say the crural region. C-R-U-R-A-L, crural. You got two bones there, the tibia, that's the weight-bearing bone. Okay, and on the skeleton it's the medial bone, and there's a lateral bone called the fibula. It's like a split. The tibia is weight bearing.
I have a question real quick.
Yeah, go ahead.
So just to be clear, is the leg the whole from like the hip down to your foot, or is it just from the knee below?
It's just knee to ankle.
Okay.
Yeah. So, in anatomy, leg is only from knee to ankle. In everyday language, the whole lower extremity is the leg, but not in anatomy. The leg is only the region between knee and ankle. That's what I'm writing here. Region between knee ankle. Then the ankle is connected to the foot. The foot will be like the fourth major region of the lower limb. And in the foot, we'll study all the bones, just to name them now. You have the tarsal bones, which are, analogous to the carpal bones in your wrist. Well, the tarsal bones, they basically form, I would say, posterior foot. Posterior. The metatarsals, like your metacarpals, they form midfoot, the arch of your foot, and well, your toes are your digits. We call fingers and toes both digits in hands and feet. So I'll teach the bones today, and don't think I'll finish them. We'll see how far I get. I want to start by teaching with what is called the pelvis, because if you put it back into the full body, the pelvis is 2 hip bones along with the sacrum. Pelvis is a word in anatomy that means wide bowl. It's the widest part of your hips. The pelvis forms a complete girdle, a belt, goes all the way around. Call it the pelvic girdle, which is your 2 hip bones. And the pelvis, the 2 hip bones, your pelvic girdle, are united posteriorly by the sacrum. Let me zoom in on it. Go to models, male pelvis, and perineum. There's the pelvis with the sacrum posteriorly. 2 hip bones united posteriorly by sacroiliac joints. So we teach the sacrum twice, in the pelvis and in the vertebral column. Those sacroiliac joints are right here and here. Okay. This is unlike your pectoral girdle. Pelvic girdle is basically connected to your vertebral column because it's connected to the sacrum. But your scapula aren't. Your scapula aren't united by anything. Okay, they're free to rotate a little more, which gives the shoulder a little more range of motion, but not your hip joint. Okay, so think of the pelvis as 2 hip bones and the sacrum. When people say pelvic girdle, they pretty much just mean the 2 hip bones. But the pelvis is the two hip bones with the sacrum. So pelvis, 2 hip bones. Let me add on sacrum here. United posterior by 2 sacroiliac joints with the sacrum. So the pelvis, there's some anatomy there we'd like students to know. For example, that pelvic inlet. Well, let me use the tool function and just draw a circle all around what's known as the pelvic. Oh, it's not a very good. I didn't do a very good job, but I think you get the idea. So let me rotate it around. Where I tried to draw a perfect circle, I failed miserably. But that represents what's called the pelvic inlet, where I attempted to draw the circle. Okay, so no pelvic inlet. Inlet implies go into what? That you go into the pelvic cavity. also known as the true pelvis. Sometimes they call the true pelvis the lesser pelvis. Basically, the true pelvis, the pelvic cavity, is inferior to this line that I drew. Okay. Now, above the line, you still have some pelvis, but it's not the true pelvic cavity, so they call it above the line, above the pelvic inlet will be considered the false pelvis or greater pelvis. Above pelvic inlet is the false pelvis or greater pelvis. Let me get a couple of pelvises over here. I'll be right back. There are some differences between the male pelvis and female pelvis. Okay, and we have one of each here. So I always ask this on the lab practicals. I put them side by side and I say, which one is the female pelvis and which one's the male pelvis? So let me tell you the differences. The female pelvis has been adapted for childbearing, child rearing. So imagine my fist is baby's head, you know, and going through the birth canal. You got to go through there, and you should be able to tell the difference. So I'll call this the gender differences between the pelvis. Unless you're born C-section, we all came into the world like this, literally, through the birth canal. And so we kind of like students to know pelvic inlet and what makes a female pelvis more adapted for child rearing. This app allows you to select female pelvis. It's one of the gender differences they have. So I'm going to get rid of my little pelvic inlet thing there. Clear, done. Let's go female pelvis. So if you look at the pelvic inlet for a female pelvis, it's more oval, roundish. Oval is usually what they say. It's wider, more of a wider oval. Pelvic inlet. It's larger, kind of oval in shape. They say that the male pelvic inlet is more shaped like a heart. And it's smaller. So this is female. Let me switch back to male. Wish I could put them side by side in this app, but it doesn't allow you to do that. So they say that pelvic inlet shape is a little more heart-shaped. It's smaller. In general, if you hold a male and female pelvis. Generally speaking, the male pelvis is more narrow and it's heavier. Whereas the female pelvis is wider and lighter. So being more wide would allow the passage of baby's head a little better. And also, the number one way I tell is something called the pubic angle, or the subpubic angle, or the pubic arch. Let me show you. Let me go to this male pelvis and basically just draw right here, where I draw the line, that angle. Okay, this is the male pelvis, and that subpubic angle, as it's called, it's more obtuse in females and it's more narrow in males, acute. Basically do this. Take your two fingers, these two, and go like that. This approximates the angle for males, these two fingers. You know, well, I can't do it like that. But if you take your thumb and index finger and go like that, that wider angle represents the subpubic angle for females. It's more obtuse. Okay, let's look at the female one. It's much wider. Okay, so I would say those are some of the basic clues to answer that question, which is a female pelvis, which is a male pelvis. There are some pelvic diameters we like students to know. I'll give you two. For example, let's see, what are they? Oh, yeah. Baby's head has to be ejected right through there. The narrowest distance out of here from side to side is from this spine and from this spine. Those are called the ischial spines. From there to there, bam. So that distance is called the interspinous distance. Okay. So, call these pelvic diameters. Know the interspinous distance. It's the narrowest distance of the pelvis, laterally. It's literally the distance between ischial spines. Where I drew the line from point A to point B. Okay. There's another distance. One more I want you to know. It would be the distance between, use the same picture, pretty much right here, sacral promontory, okay, with that point basically to here. Okay. So sacral promontory, and then this is the pubic symphysis. Okay. The distance is called, it's a weird name, true conjugate, that second one I drew. That is the distance between sacral promontory and pubic symphysis. So that's the narrowest distance from front to back, basically. And so this is, you know, things you think about if you're going to give birth. I'm sure your obstetrician has an interest in knowing what these are. Okay. And what are they? What are the numbers? I can't remember right now. You know what a good thing to do is? Get a tape measure in lab and measure it. 17, 20 centimeters, something like that, right? That'd be a good thing to do. Okay, so basically another way to visualize the true conjugate is from a different perspective. So let me change the perspective here.
The measurement, is it only much concentrated on the female?
Female, I think the numbers are more for the interspinous. I'm not sure actually. I'm not sure.
The point is all these measurements, like
Yeah, your obstetrician will know. Let me show you something. Let me see you do this here. Yeah. By the way, I'm not a medical doctor. I don't try to pretend to be one. But anatomy is a medical science. So there's a lot of crossover. Okay, here's another way to visualize the true conjugate. Draw a line from here. Wait, come on. Let me just use 2D pen. Let me just draw the board. Get it. So this is a side view. You see the sacrum in back and the pubic symphysis in front of you. So point from here.
Is that from the right side?
That is correct. That's the true conjugate, from back to front. And what the obstetrician can do with their fingers, they can kind of go like this. And this distance, usually they can palpate all the way back here, okay, through the vaginal canal, I think. I've read this. Again, I'm not a doctor. But anyways, that can, based on the doctor knowing their own hand, they can kind of estimate, okay, yeah, I think you got enough room there. Or if they feel like it's too short, oh, it's really small pelvis you got there. Maybe they have some concerns for you if you're going to give birth, but it's a conversation for you and your doctor. But in anatomy, I just want you to know, this is called what? True conjugate. I mean, that's what you got to know. Okay, so we did the gender differences. Since I mentioned pubic symphysis, let me show you that. That's the name of the joint in the front, basically, for the pelvis. Let's go back and look at the full pelvis. Go back to male. Show hidden.
That allows it to expand for the baby to come out?
It does. The hormone, what's the hormone? Oxytocin.
Yeah.
That'll kind of loosen that joint to make it a little more movable as baby's head squeezes out. So I've highlighted in green what's called the cartilaginous joint in pubic symphysis. I want you to know that joint. Of course, as you're giving birth, I'm sure you're not thinking, my interspinous distance is too short. You're just trying to push the baby out. But these numbers your doctor really wants to know about. So the hormone oxytocin, it's the hormone I teach in 431. It does a lot of things. It helps the uterus contract, but it does help loosen the tissue of that joint. So that joint is called pubic symphysis. And basically, it's a cartilaginous joint. So we kind of like name joints and describe them based on the tissue that binds the two bones together. So this one's cartilaginous.
And that can move? Or
Slightly, yes. More so during childbirth and child rearing because of oxytocin that's released during labor and delivery. Okay, so it moves, but not much. And basically, so what was I going to say? Oh, I was going to say it unites the two pubic bones anteriorly. Okay, so know that the pubic symphysis joins the pelvis anteriorly, but what's the name of the joint back here that unites the pelvis posteriorly? Sacroiliac joint. So those are the two joints of the pelvis you're expected to know. Sacroiliac joint posteriorly and this joint anteriorly. Sacroiliac joints, I'll say unite pelvis posteriorly. So what's the other thing I wanted you to know? Okay, let's move on to looking at just the hip bone itself. Stop, let me highlight things. Hold on. Hide others. Okay. Here we go. So this is one hip bone, and I'm rotating it using the app. That perspective is anterior. So watch me now. If this is anterior, I'm going to rotate it. What view is that? That's lateral. So let's do it again. That's looking at it from the front, anterior. I rotate it just like that. That's a lateral view. If this is lateral, watch me now. Don't take your eyes off the screen. What view is that? Medial. So let's get used to the views. That's medial, okay? That's lateral. This is anterior. That's posterior, okay? On your coloring book, I have two views. The lateral view and the medial view, okay? One thing you should know is that the hip bone is actually composed of 3 bones fused together. Three bones fused together. At the acetabular. So let's switch to the coloring book here and see here. All right, which view is this? lateral. And basically, the acetabulum, let me get some other colors out here. Let's see, I got red, I think. I got blue, orange. The acetabulum is a word that means wine glass. It's a deep socket. Okay. It's right here. You can see it laterally. It's that thing there. So what that deep socket does, it receives head of femur, and that's the hip joint. Forming hip joint. So know the acetabulum. The other thing is that, well, the three bones that fuse at the acetabulum are the iliac bone, pubic bone, and the ischium. Ischium, or yeah, well, basically, those are the three bones, and they fuse at the acetabulum. So it's like, I'm going to draw a Y-shaped fusion here. The Y-shaped fusion where all three bones fuse is called the triradiate cartilage. But before I do that, the iliac bone is the fan part. I mean, all the way, let me use blue, color coded. It's all this. Okay, all that superior stuff, all this is the iliac bone, the big fan shape. When you put your hands on your hips, it's pretty much, you're putting it on the crest of the iliac. The pubic bone is anterior. So on this view, it's right here, basically, kind of a sideways V. On the other view, it's kind of here. I'm just giving you rough approximations. So on the other view, I should also kind of like outline the iliac bone. It's all this up here, roughly. I'm just giving you a rough approximation. Okay, the bone that's posterior that you literally sit on is the ischium, your sit bone. And it's pretty much from here to here. Okay, just giving you a rough outline of it. So it's posterior. So on this view, it's all this. Okay, if that helps you. So know how all three bones, they basically fuse in the acetabulum. I know I didn't really illustrate it that way, but I just want to give you a rough idea of the three parts of the hip bone, because you are expected to know iliac bone, pubic bone, and the ischium.
In general, one posterior view.
Yes. So this is posterior. This is here. Let me use my pointer. On this lateral view, this is posterior. So that's posterior. This is anterior for the pubic bone. and that's anterior. I know it's kind of hard to kind of stare at an image and get it straight in here. That's where we have lab. And I want you to know that where they fuse in the acetabulum, this Y-shaped fusion is called the triradiate cartilage. That Y-shaped fusion. For those of you who use the atlas, there's a whole section on pelvis and perineum that's very useful. There's a lot of good pictures in there. And there's an X-ray image of triradiate cartilage on page 229. Fusion does not occur till around age, some books say 17, some books say 25. I'll give you a range, something like that. Later in life, you know, it's fully fused. There's no cartilage in between the three bones of the hip, the iliac bone, the pubic bone, and the ischium. The other thing to consider, to look at the entire hip bone, is this circle right here. Well, it's not a circle, it's a hole, or here. That's called the obturator foramen. It's a hole when you look at the dry bones. Know that. In anatomy, as you well know, I hope you know by now, that foramen means hole. Okay, foramen. However, in life, that hole is filled with a connective tissue membrane called the obturator membrane. And there are two muscles that attach to this flat membrane, and they're called obturator internus, obturator externus. They originate from this membrane. So that hole has a sheet called obturator membrane. There's two muscles that attach on either side, on the inside and on the outside. I wanted to use the app to show you that. I think I saved an image of it, a library. Let's see, where is it? So that muscle highlighted is the obturator externus. And there's the obturator membrane filling the obturator foramen. If I rotate it so you get an inside view, that muscle is the obturator internus. And those two muscles are gonna, but you see how they extend outwards? They're gonna attach on the femur and help rotate it. When we get to muscles, we'll learn it, okay? So basically, the obturator membrane is deep to that. Okay, and when you study the hip bone, it's just gonna be a hole called obturator foramen. But anyways, that's what I want you to know. There's some surface features of each bone I wanted you to know. We'll start with the iliac bone. The iliac bone, when I said earlier, when you put your hands on your hips, that's called the iliac crest. So think of these as surface features of the iliac bone. It's the top part, it's a crest. And so basically, if you go from anterior to posterior, just make a big rainbow. That's what I would do for this view or for this view. It's the iliac crest, just the very top. If you go all the way anterior, you have the anterior superior iliac spine. And the anterior superior iliac spine is palpable. That means you can feel it through your skin. So if you feel right here a big bony protrusion, that's it. And so on the picture, it's approximately, let me use blue. This one. It's right here. On this view, it's about right here. The anterior superior iliac spine. Posteriorly, that big notch you see is the greater sciatic notch. The greater sciatic notch has a nerve that passes by it. It's called the sciatic nerve. Okay? It's associated with the sciatic nerve. We'll look at the sciatic nerve later. Well, anyways, the notch I'm referring to, green, it's right here, this notch posteriorly. Or on this view, it's this one. One more structure. It's called the arcuate line. The arcuate line, when I trace the pelvic inlet, the arcuate line is a part of the pelvic inlet. That line can be drawn, well, you can see it from the medial view. It's pretty much a smooth line, kind of like right there. Can't see it from the lateral view. You can see it from the medial view. Again, this is medial. This is lateral. Again, always orient yourself with our bones, like if it's a test, and if you you see acetabulum, it's the lateral view. If you don't see acetabulum, it's the medial view, basically. So those are the surface features for the iliac bone. Let me make sure I'm not forgetting anything. Okay, I'm going to show you a few things on the ischium. Some people pronounce it ischium, but I think most people pronounce it ischium. I-S-C-H. Okay, kind of a confusing spelling. I-S-C-H-I-U-M. There's the ischial tuberosity. You know, some people call the ischium your sit bone. Because you sit on it. And the ischial tuberosity is the part of this bone that you're sitting on. The tuberosity, it's a very rough surface. And as we get into muscles, you'll see a lot of hamstrings originate from the ischial tuberosity. Hamstring muscles basically originate here. We'll show you that later. Well, anyways, let me kind of see if I can highlight it here. On this view, it's pretty much right there. On this view, I don't see it. It's kind of on the other side, so I won't try to draw it in. But I see it here, posteriorly. It's what you sit on. And then you have that thing I mentioned earlier called the ischial spine. I gave you the distance between them. It's called the interspinous distance. Also, there's a ligament that attaches there called the sacrospinous ligament. I'll show that ligament to you later. LIG ligament attaches here. I use blue here to see. So it's that little thing poking out right there. I see it there. I also see it right here. The ischiospine, look for it. Then I have ramus of ischium. Ramus means arm. It's just a thin bar of bone. That's how I'll describe it. It's kind of bordering the obturator foramen. So basically, I'm going to say it's like roughly here. Okay, it's where I'd put the tape for ischial ramus on that view. On this view, it's supposed to, I'm going to say it's like approximately right there. Thin bar of bone called the ramus of the ischium. Okay, so you can see that these surface features are all posterior on the hip bone because the ischium is your posterior inferior sit bone. And then you have the pubis, the last one. Pubis or pubic bone anteriorly. I won't write it again, but I already gave you the joint, the pubic symphysis that unites the whole pelvis anteriorly between these two bones. And the pubic bone got its name because above that bone is where you have your pubic hair, right? Pubic hair in the region. I got a few surface features here. I have the superior and inferior ramus of pubis. So if I'm going for superior ramus of pubis, I'm going for, on this view here, it's kind of there. Okay, superiorly. And on here, maybe it's kind of this part here. If I want the inferior ramus of pubis, I will kind of take maybe this part here. And maybe from here to here. So the inferior ramus of pubis kind of runs up to the ischioramus. So you have to be very careful where I label for a test or a quiz. If I'm pointing more to the front, it's the inferior ramus of pubis. If I point more towards the posterior, I'm going for the ischioramus. Okay, so those kind of run into each other there. The other thing I have is a little bump at the very tip, and it's called the pubic tubercle. The pubic tubercle, I use orange, or dotted. I mean, it's literally a little bump right there at the very tip. So look for a little bump at the apex. You can't see it, it's kind of on the other side, but I'll put where it would be. Basically at the tip of the apex of the pubis. That's important to know. There's a ligament that runs vertically between the pubic tubercle and the anterior superior iliac spine. That's the inguinal ligament. So note that pubic tubercle, the inguinal ligament runs vertically between pubic tubercle and anterior superior iliac spine. those 4-word terms. Anterior, superior, iliac spine. To help you remember the order, just remember ASIS. But of course, on a test or a quiz, you have to write it out. ASIS is just to help you to remember the order. Although there are 2 S's, so I guess you can mix up the S words. You just have to remember. So that ligament basically is completely vertical. Boom. Boom. So when you have a hip bone at the desk, if you want to put it in the anatomical position, you know, standing straight up, how would the hip bones be placed when you're standing erect? What you got to do is put pubic, tubercle, and ASIS in the same vertical plane, and that represents the anatomical position. ASIS and pubic tubercle are in the same frontal plane in the anatomical position. And that ligament that runs between them, inguinal ligament. All right, I think that's enough for today.